Hi, everyone. Welcome to the Do What You Can Live With podcast. I'm your host, Brandi Mac. And in this rather short episode, I kind of went on a deep dive today regarding the alcohol industry, because I don't know if anybody else has noticed, but alcohol is one of those substances that is just not stigmatized in the same way that other illicit drugs are. It's widely accepted. You feel like you don't fit in if you go out and you're not drinking. My mother's in recovery from alcoholism and my father struggled with it. But people who clearly struggle with alcohol use, they do not look at others who struggle with illicit substances the same even. And I don't know, to those listening, if you realize this, but alcohol takes way more lives. The number of deaths that we have each year, it averages around 178,000 of alcohol-related deaths. And anybody who has loved someone that struggles with alcoholism, it's horrible because it's accessible, it's everywhere, it's accepted. And working in critical care as long as I have, I've cared for so many end-stage cirrhosis patients related to alcohol use. And it is a horrible way to die. And it is extremely painful for the families because it is not something that takes them quick. So I decided to just kind of do a deep dive on this trillion-dollar industry. So some of the things we're going to cover in this episode is the alcohol industry, the lobbying that takes place, the manipulation of government language around addiction, and how the words we use today were shaped by corporate interest. I did say it. And all these claims are backed by peer-reviewed research. I just want to say that. When I do a deep dive, I do a deep dive. So what do we call substance use, right? We call it substance use disorder. Now, it used to be called substance abuse. And when I found out that the alcohol industry played a part in using the term substance abuse, because how they would refer to it previously, when any organization would talk about illicit substances, they would say alcohol and drugs. And the industry didn't like that because it was putting them together and they wanted to make it less obvious. CSAP is the Center for Substance Abuse Prevention. It is a federal agency. Your tax dollars fund it. Its job is to protect the public from dangerous substances. And I guess back before the 2000s, the agency actually used to call alcohol what it is, a drug. The official phrase was alcohol and other drugs, because that is the truth. Alcohol is a drug. It is classified as a group 1 carcinogen by the World Health Organization even, which is the same category that tobacco and asbestos fall in. But you see, the reality is that what money makes the world go round. And so the alcohol industry, they simply did not want their product called a drug. It hurt business. So what'd they do? Well, they lobbied a federal agency to change the words. And the agency did just that. And what I mean by that is they ended up dropping the alcohol and other drugs slogan from their guidelines and replaced it with substance abuse. Sound familiar? So today, I'm going to talk about how the words we use around addiction were actually shaped, not by doctors, not by families, not by people in recovery, but by a trillion-dollar fucking industry that needed to protect its profits. And we're going to talk about what that means for you and your family. So before we get into the language, I want to give you some numbers, because these numbers kind of explain why the alcohol industry works really hard to control how we talk about their product, okay? So the first number, 178,000. That is how many Americans die from alcohol every year. Now that is the CDC's number, not mine. 178,000 1,000 people every year. Now, here's the number you hear about all the time: drug overdoses. For instance, in 2023, about 105,000 Americans died from drug overdoses. And in 2024, that number dropped to about 80,000, which is incredible progress. And honestly, I give all credit really to harm reduction, because we finally kind of accepted that. And when we were able to get Narcan out there, education, it made a huge difference. And obviously, coming out of the COVID era when people were so isolated, absolutely contributed also. But hold those two numbers next to each other. Alcohol, 178,000. All drug overdoses combined, 80,000 to 105,000. Alcohol kills roughly twice as many Americans as all drug overdoses put together. Do we hear about that? No. We have a fentanyl epidemic and all this focus on fentanyl and keeping the cartels out. We got to blow up these boats, because we don't want these drugs coming into the country yet. The one that's killing more Americans each year, well, it's available right on most shelves, easily accessible, and widely accepted. So how many of you knew that? I honestly didn't. I had always heard that alcohol actually did kill more people, but I had never done a real deep dive. And alcoholism impacts so many. And I've had a lot of people request for me to talk more about this. And I figured no better time than now. But I'm sure there's many of you listening who probably didn't know about that. And I'm going to tell you this. That is by design, for sure. You see, globally, it's even worse. The World Health Organization, for one, has said that alcohol kills 2.6 million people every year around the world. All other drugs combined kills about 600,000. So if alcohol kills 4 times more people globally than every other drug put together. But when we think of a drug problem, we're not thinking of alcohol, right? Unless you're the one living it, then you absolutely are thinking of alcohol. But the average person in society, they're thinking of fentanyl, meth, cocaine, heroin. That's what they're thinking of, not alcohol. Instead, we want to picture something that's illegal, something that's scary. And I think most people have this image in their head that all people who struggle with substance use, that they're homeless, that they lack morals, that they came from a horrible family. And as you and I know, that's just simply not the case always. I think most of the time it's not. But the separation between alcohol and drugs, that did not happen by accident. It was built with billions of dollars. So we're going to kind of go back and to explore a little bit of history. So I mentioned the 1990s, right? So you see, the federal government had an agency called the Center for Substance Abuse Prevention, or CSAP. This agency was doing something the alcohol industry did not like, and it was using the phrase alcohol and other drugs in all of its materials. So think about that phrase, as I mentioned it earlier, alcohol and other drugs. It is accurate, it is clear, and it tells the truth. It says alcohol is a drug just like the other ones. But if your business is selling alcohol for a living, that phrase is going to be a real problem. Because the moment people start thinking of alcohol as a drug, they start asking uncomfortable questions like, why is this legal? Why is this drug advertised during the Super Bowl? Why does this drug not have a cancer warning on the label, even though the World Health Organization classified it as a carcinogen back in 1988? And to me, this is the most wonderful part of this. So what did the alcohol industry do? They created their own organization called the International Center for Alcohol Policy, or ICAP. This was not a health organization. And of course, it was biased because guess what? It was funded by the world's biggest alcohol companies, and they used it to pressure the government. So, this new biased International Alcohol Policy Organization, they completely, more or less, in my opinion, manipulated the government. So the meetings with CSAP, they formed a joint working group, and publicly the meetings were framed as a partnership and a collaboration, the joint report had said. So even though we know alcohol is a drug, behind closed doors, something very different happened. The industry got exactly what it wanted. They got CSAP to change its guidelines. They were able to get them to drop alcohol and other drugs and instead replace it with substance abuse. So I want you to sit with that. A federal agency funded by your tax dollars, whose job is to protect you, changed its language because a corporation told them to. And then the corporation went and celebrated it. It reminds me of like the OxyContin epidemic and how they have manipulated the FDA to say that OxyContin was non-addictive when they knew it was very addictive. This to me is a perfect example of that. But, look what happened with like the Sackler family and them being sued. We're not seeing that with big alcohol. Now you could be sitting there thinking, so what? They changed the words. Does that really matter? It's just words. No, it does matter because words are everything, especially in healthcare, especially when it comes to addiction. Because those words will decide who gets help, who gets compassion, and who gets left behind. Now let's talk about, so what happened after alcohol and other drugs slogan disappeared from government language? Well, substance abuse became the standard term. Now let's go to the medical side. So for those who maybe don't know, there is the DSM-5, which is a diagnostic manual that the American Psychiatric Association updates every so often with new diagnoses. And the term substance abuse, they ended up getting rid of that term and substance dependence. They removed both of those, okay? And they ended up instead replacing it with a new term, which is what we use today, which is substance use disorder. And part of the reason, I guess, for why they had removed the word abuse was because that word was seen as shaming. And the reason I bring that up is, that's nothing against like that association with the DSM-5. But the problem is, the phrase alcohol and other drugs, which had been out of federal language for, 20 plus years, that cultural separation, the idea that alcohol is somewhat different from drugs, was already baked in society's brain and how we talk, how we view it, how we treat people. I mean, I see it even in healthcare. People who come in with alcohol use disorder, they absolutely, I feel, are treated better than people who come in that struggle with illicit substances. And giving you some even other numbers to throw out there. In 2023, the alcohol industry spent almost $30 million on federal lobbying, working Congress. And then if you look at the leading public health group working on alcohol harm, which is the U.S. Alcohol Policy Alliance, well, their total revenue in 2023, from what I could find, was around $323,000. And as far as I can see, none of their staff is even paid. So the CEO of Heineken makes more in a month than the entire domestic alcohol advocacy movement makes in a year. Think about that. In all honesty, I'm not surprised. See it every day in the healthcare system, profit over patient. This is what happens when big corporations control everything. And the issue is it's not just lobbying. And in one study I found, it estimated that the global spending on preventing alcohol harm combined, this is global, was $5 to $10 million per year. So let's look at HIV and AIDS, okay? That gets $10 billion per year. Alcohol causes 3 times more deaths worldwide than HIV and AIDS, but it gets less than 1,000th of the funding. And then look at taxes, right? We pay a lot of taxes. I think all of us do. All right. So there's essentially been this alcohol tax and all the harm that is being done to the people who struggle with alcohol use. Well, all the money that big alcohol has been making and lobbying, they were able to get Congress to lower the taxes on alcohol. And that happened in 2020. Bipartisan support, mind you. And what's even more disgusting about this is that it's not like the data does not exist of the damage that alcohol does to people. They all know the harm that it causes, yet they get their taxes lowered because by getting the alcohol tax lowered, well, it's more appealing. People can afford it. They're more likely to buy it because it is so affordable. So why does this matter? And I get a lot of you're not into policy. Honestly, I find policy super fucking boring also. But unfortunately, when you do deep dives like this and you want to know how these things came to be, it all comes back to policy. And I know this has been a lot of information, but the thing is, you're either a parent or a spouse or a sibling or a child of someone who has struggled with alcohol. And you are wondering, what does any of this have to do with me? It has everything to do with you. Because the reason your crisis feels invisible, that was by design. The reason people shrug when you tell them your loved one is drinking themselves to death, that was manufactured. When you feel like you're crazy, like nobody's taking it seriously, that was bought and paid for by people who make money when your loved one keeps drinking. So let me say that more clearly. The research shows that more than half of all alcohol sales by volume are consumed by only 10% of their customers, the heaviest drinkers, the people who are the most sick, the people your family is trying to save. And the industry does not want those people to stop because those people are more than half of their revenue. So they spend billions making sure alcohol stays cheap. And they work really friggin' hard to make sure that in our minds, in our language, in our culture, that alcohol stays as far away from the label of being called a drug as much as possible. Because you see, the moment we start treating alcohol like what it is, a drug that kills more Americans than every other drug combined, the whole game will change. And so I don't know if you guys knew this. What happened when hemp became widely available, it was hurting alcohol sales. Well, big alcohol can't have that. In November last year, when we were in that really long government shutdown, they had to pass a funding bill to get the government back open. Well, buried inside that bill was a provision that essentially banned pretty much most hemp THC products in the US. And guess who the people were that pushed the hardest for that ban? It was the alcohol industry. For a little backstory, in like 2018, there's something called the Farm Bill, which ended up making hemp legal nationwide. And so that business has really blossomed. I mean, it has just grown in large amounts. And they make drinks, edibles, which have THC in them, and they were kind of just popping up everywhere. And guess what happened? Beer and liquor sales dropped by about 5% because the hemp drinks were able to offer people a buzz without the hangover, and the health-conscious buyers were all over it. And big alcohol, they did not like their profits being cut into. In the months leading up to November last year, some of the biggest names in the alcohol industry, well, they went to work in Washington and they were actively working to influence federal hemp laws. And apparently there were some letters that had gone around that were like, act immediately to remove hemp products from the marketplace. There were millions given in campaign donations to members of Congress in a single year to lobby for this. That's the type of influence corporations have over our government. We have none. That's the reality of it. We essentially have none as long as lobbying is allowed in this capacity. And the real messed up thing about it is there was like no heads up about this. It was slipped in out of desperation with the government funding bill that had to be passed. And from everything that I could find, the direct lobbying pushed from trade groups that were representing large alcohol companies and beer makers. And this is just more or less a sickening and perfect example of how these huge industries with deep pockets and relationships, because God, how old are some of these fucking people in Congress? We should absolutely have term limits. And I'm not even trying to get political, but this is like a perfect example of that. Big alcohol paid all this money to essentially make their competition illegal by the government. And Americans didn't even know until that bill was signed. And now there are a lot of small businesses, farmers, this entire industry. They have a year until it goes into effect, is essentially destroyed. So that's fucked up. So more or less, I'm not telling you all of this to make you feel helpless. I'm telling you this because knowledge changes essentially the game for families. It's basically to tell you that the fear and the pain you're living by loving someone who struggles with alcoholism, it's not an overreaction. And what I want you to take from today is that, one, alcohol is a drug. It kills 178,000 Americans on average each year. And the only reason we're not calling it a drug is because of $1 trillion industry. And then the words that we use around addiction, that's the second thing I want you to know, is that when you hear substance use disorder, I want you to think of the alcohol industry and how their money and their lobbying shaped the way we view addiction today, the way alcohol is viewed, widely accessible, more or less promoted, and there's always some health benefit being quoted, even though we know that it absolutely does cause cancer. Well, you're not crazy. This has all been very well crafted by people getting rich. But the reality is, you can't change the alcohol industry. You can't rewrite federal policy. That is not your job. But what you can do, you can love the person. You can protect yourself with boundaries and make decisions that you can live with at the end of the day. You can stop second guessing yourself. You can look at the people who say, oh, it's not that big of a deal. It's just 1 or 2 drinks. It's just alcohol. And know in your bones that they are very wrong, not because of an opinion, but because the data shows that they are. So to wrap this up, I'm going to end it with a question. If they died tomorrow, could you live with how you love them today? You see, the alcohol industry does not get to answer that question for you. Only you get to answer it because you're the one living it. You're the one paying attention and your eyes are open. So I hope you found this information valuable. And please, by all means, if you enjoyed this episode, please like, follow, share with somebody who also loves someone struggling, or maybe someone who's struggling with alcohol use themselves. And I appreciate each of you. And until next time, take care.